Welcome to Hillary Topper On Air, the podcast you can't afford to miss.
Did you know that last year alone, more than 250,000 people died in the U.S. as a result of medical negligence? That's a ridiculously scary statistic. I'm Hillary Topper, and this is a special edition of Hillary Topper On Air. This edition comes to you thanks to Pigalis and Erickson, LLC, a New York law firm for people suffering as a result of medical errors and personal injury. Today, I'm so excited to be talking with one of the partners, James Baydar, and he's going to tell us a little bit about this statistic and some other things that we all should be very aware of. And without further ado, Jim, welcome to the show.
Hi, Hillary. Thanks for having me. I appreciate it.
You got it. So tell me a little bit about your background and yourself. How did you get into this field?
Actually, I got into the field about 31 years ago after graduating from law school. The field found me as opposed to me finding the medical malpractice firm. It is the first job I had out of law school, and I'm still here after 31 years.
Wow, that's awesome. That's awesome. So they must treat you great there.
It's a mutual relationship. I think I treat them well, and they treat me very well too.
Awesome, awesome. So tell us a little bit about Pigalis and Erickson. What type of law firm are they, and what do you guys do to help people?
Sure. Steve Pigalis started 40 plus years ago in the personal injury field. And one of the first cases he handled was a medical negligence case. And this goes back to a very long time ago. And that's when medical negligence cases, also known as medical malpractice cases, were not very popular in New York. When I say popular, they were not prevalent. He tried a very early case in his career. It was a medical negligence case, a medical malpractice case. And he was very fascinated with it, very intrigued. He did well with the case, and I think that was the beginning of his career in the medical malpractice field. And I should be clear, that would be on behalf of patients, on behalf of people who receive medical treatment from doctors and hospitals. Eventually, over 20 years ago, he formed this firm with Steve Erickson, and we are 8 lawyers now. It's pretty stable. We've been 8 lawyers for about 20 years now. All of us practice in the field of medical malpractice. We also handle other serious personal injury type cases, but by far most of our cases involve medical malpractice, and that would be on behalf of patients who have sustained injury as a result of substandard or negligent care from a healthcare professional.
It's amazing to me. I mean, you probably had heard that my sister was misdiagnosed with migraines and ended up having a brain aneurysm and passed away a couple of months ago. And, you know, to me, it's like this happens time and time again. Why do these types of medical mistakes happen? And how could this be? You know, can you talk a little bit about that this is the 3rd leading cause of death in the United States?
Yes, that information came out in a study, I believe, by Johns Hopkins University, and the information was derived from the Center for Disease Control. Regarding your sister's situations, which is horrifying, we actually have a similar type of case involving a young man who presented to the emergency room several times with a very bad headache. And ultimately, what they diagnosed was a migraine, and they sent him home. He came back multiple times within a period of about a week or 10 days. Ultimately, after not a lot of testing, after doing the right testing, they diagnosed a massive infection in his brain, and he had to have part of his brain removed. Why? The key is how information is gathered and how it's communicated. Preventing diagnostic errors is crucial. And to get to that point, to get to the heart of the matter, there has to be very good communication between the patient and the doctor. When a patient comes in to see a physician, he or she's not coming in because they're healthy and everything's fine. They're coming in because there's a problem that they detect. They don't feel 100%. It's up to the patient to relay to the doctor as completely and as accurately as possible what the patient is experiencing. Now, doctors are trained to elicit medical history from patients. So if the patient is able to recall some of the signs and symptoms with the proper prodding and proper questioning by a trained healthcare professional, a medical doctor, for instance, more information would be able to be obtained by the healthcare professional. More information is very empowering because when you have an accurate and complete description of what's going on with the patient, that's when the doctor's role is key because they are responsible for gathering that information, analyzing it, evaluating it, and coming up with a plan of care. And the plan of care could include testing, it's very specific testing. It could include waiting. It could include referral to a more specialized medical professional. So they have a lot of tools in their armament. They have the ability, or they should have the ability, to put together what's going on in particular with that patient and what's needed in order to come up with a proper plan of care. Without a proper plan of care, a management plan, that's when everything falls apart. That's when problems happen. That's when patients fall between the cracks. And more often than not, it's because the physician hasn't elicited enough information or the proper information and hasn't put together a proper plan.
Do you also think that it could be because of managed care, that you're in and out, especially when it comes to ER rooms, visits, and that type of thing? I mean, do you think that has anything to do with it?
That's an excellent point. In today's medicine is practiced very, very differently than it was 20, 30 years ago. The interactions between a patient and a healthcare professional are much shorter in time. Sometimes when a patient's with a physician, it could be literally for a couple of minutes, depending, of course, on the severity of the signs and symptoms and why the patient is there. So it's very important for the patient to be as proactive as possible, be as complete and accurate with the information you're giving to the doctor or to the physician's assistant or to the nurse, because it's up to the healthcare professional to put it all together. Now, managed care does have a big impact on that because physicians sometimes in a big practice are required to see many, many dozens of patients per day. And physically, you can't do that you can't spend more than a few minutes with each patient. So it's very important for them to gather the relevant information as completely as possible and see how that fits into the overall picture of what's going on with that patient. Why is the patient here? Is it a well visit? Is it a sick visit? Are they here because they have a physical complaint? Are they here just for a renewal of a prescription? But managed care definitely has an impact on it, and especially if you want to go into an emergency room. Managed care is totally different. We have a recent example of someone who had this is not a case, but just a story about what happened very recently, actually last night. Someone we know went into the local emergency room. It's a well-known hospital. They had a slight burn on the hand from doing some work in the kitchen. And after an hour or two, instead of getting a Silverdene subscription, which is a cream for an ointment for a topical ointment for the hand to alleviate the pain and to treat the condition, the patient was given a prescription for Percocet.
Sure.
So the patient said, "No, I don't want the Percocet," and it went all the way up the chain to the emergency room attending physician who was on call. excuse me, not on call, the emergency room physician
Mm.
who was attending that night. And he explained to the patient, well, you don't have to take the Percocet. And it went back and forth and back and forth. Of course, you have to assess the degree of pain. She was there because of pain, but it was because of the burn. So are you going to treat the pain or are you going to treat the burn?
Sure.
They wouldn't give her a prescription. They would not give her a prescription for the Silvadene. They said, no, you are required now to go to your primary care physician, have another evaluation, and then let the primary care physician give you the prescription for the cream, as opposed to getting the treatment right there. Instead, for whatever reason, they were pushing the Percocet, which the patient rejected.
Well,
Probably better off for the patient too.
that leads me to the next question. I mean, there is an opioid epidemic in this country. Can you talk a little bit about opioid safety?
Certainly. The opioids have become a huge problem. As you know, many municipalities, cities, counties, and attorneys general throughout the United States have commenced lawsuits against the big pharmaceutical companies that are producing these. I think there was a recent disclosure of a small town somewhere in the Midwest with a population of under 1,000, where I think they sold and dispensed over 1 million opioid pills in a period of a year. How they didn't know that people were coming in from other parts and getting the prescriptions, probably which were not called for, not indicated, not necessary, is unbelievable. But in any event, the opioid safety issue is huge, and a lot of it has to do with common sense in terms of teens and young adults. If they're prescribed an opioid for pain management, really that needs a lot of management. It needs a lot of attention because these opioids are addictive. They could become addictive very quickly. It's a huge problem. The issue is the tolerance for pain. A lot of it's common sense. If you're going in for a minor injury and they're pushing an opioid, for instance, if you go in with a burn on your hand and they're pushing, an opioid to take care of your pain relief, you have to take a step back and say, why are they prescribing this? Do I really need it? What are the alternatives? What can I be given that is potentially less harmful, less side effects, fewer side effects? So the patient has to be thinking about it, and most importantly, the healthcare provider who's prescribing the medication has to be thinking about it. Is this a patient who really needs this for this condition? What are the alternatives? What's less addictive? What would be safer? Those are the types of issues that I think every healthcare provider has to think about, especially when dealing with the opioid situation.
Absolutely. And this leads me to my next question about, being proactive and having that proper communication. I think that the issue is that a lot of people go to a physician and don't feel 100% comfortable. They forget what they are there for. They feel a little bit intimidated. Can you address that?
Yes, certainly. There are a lot of people, I understand the type of patient you're talking about. They're reluctant to go in the first place.
Right.
And then when they're there, they're given a stack of forms to fill out, and it's very intimidating. They're asked every question under the sun regarding their history, but information is very empowering. The more relevant information you can impart to your healthcare provider, as completely and accurately as possible, the better it is for the patient and the better it is for the physician who's trying to treat the patient's condition. Like I said before, the interactions with the medical profession with today's managed care is much shorter. The amount of time you're spending is much shorter. So filling out those forms takes on a unique twist. They're very important, but it's also important for the person who's inputting the information into the computer to make sure that it's complete, and it's important for the doctor to review all the information. Oftentimes, you report something and it's not being inputted by the healthcare professional staff. So that's one error right there. Another error could be that the information is relayed to the staff, but and it's not picked up by the physician for whatever reason. We've had cases where a medical diagnosis was made in early adulthood, and it's carried for years and years, and this now predates electronic medical records, EMRs. And then when the switch was made to EMR from standard handwritten notes, a particular diagnosis was dropped for whatever reason. It was an oversight. Eventually, when this patient was presented to the hospital with a severe situation, they never had the diagnosis that he had in his medical chart from early adulthood.
Wow.
And he was treated improperly. But had they known about the earlier diagnosis and had it been included in the medical chart, he would have had a different outcome. So, in terms of being proactive and communicating with your healthcare provider, information is the key. Now, what the patient thinks is important, the doctor may not think is important. It's up to the doctors are trained in medical school and through residency and maybe fellowship to elicit relevant information as much as possible with respect to the presenting complaint. If you're going in for a headache, that you have a headache for a week and you want to see a doctor about that, it's up to the doctor to find out how long have you had the headache. Is there an ebb and does it get worse when you do certain activities? Does it lessen with other activities? Does it come and go? Is it constant? There may be tests to run. The doctor may also say, you know what, this has to go to a neurologist. It's beyond my expertise. I want to get an expert involved who has more specialized information with respect to a certain condition. So information is very empowering, not only for the patient, but for the doctor. Also, with respect to managed healthcare and the short time period that patients have with their doctors, you know what? Sometimes it helps for the patient to be a little pushy. If you're going in for a condition, a doctor has to make an assessment called a differential diagnosis. And that's all the possible diagnoses that this patient could have based on the signs and symptoms and the test results. And usually it's the most serious, and then you list to the less serious. And it's up to the doctor to rule in or rule out each of those differential diagnoses, obviously starting with the most severe. Getting the information and analyzing it in terms of a differential diagnosis is what medical healthcare, what medical professionals do every day. Sometimes things are missed, and that's what could possibly create a lawsuit.
Let's talk a little bit about preventing infection. Can you talk a little bit about that?
Yes, infection. There have been many, many studies over the past decade regarding infections. There's a fancy medical term called nosocomial infections. Those are hospital-acquired infections. As you probably know, and some of your listeners know, you can go in without an infection and come out or be hospitalized and acquire an infection while you're in a hospital. Those are hospital-acquired infections.
Mm-hmm.
A lot of that has to do with certainly you can get an infection from instrumentation during a surgical procedure. Those are not as common, however, because there's very strict controls. Obviously, when controls are not adhered to, problems occur, and problems can lead to lawsuits. Washing your hands, everyone who's ever walked into a hospital has probably seen every 50 feet or 100 feet the Purell stand,
Mm-hmm.
where you can wipe your hands with the lotion, and that basically takes care of some of the germs on your hands. It's not completely preventative. But washing your hands cannot be underrated, especially during cold and flu season. Whether you work in an office or outside, it's very important. But not only is it important for the patient, it's important for the healthcare provider. As someone in a hospital or in a private office is seeing patient after patient after patient, it's important for the healthcare provider to maintain cleanliness. I think there was a study out there about stethoscopes, the germs on stethoscopes because they're not
Oh,
cleaned so frequently.
oh no.
Yeah, that's another thing for you to worry about. I know. You see healthcare professionals walking around with stethoscopes around their neck all
Yeah.
day long.
Yep.
I don't know how often they're being wiped. I think there's a
Mhm.
study or more than one study about that. But in terms of infection control, it couldn't be overrated at all. It's very, very important, especially this day and age where human interaction is everywhere and anywhere.
So tell us a little bit about some of your wins or, cases that you think would interest the listening audience.
Sure. I mentioned a case that was eerily similar to your sister's case regarding the headache, where they diagnosed a migraine. It turns out to be a massive infection in this young man. Um, Another case we had is a young man, a 26-year-old man, who had what they diagnosed as recurrent pneumonia. Kept coming in, breathing difficulties, coughing. No, it's pneumonia, coming back month after month after month. This went on for over a year. Eventually, someone decided, well, why don't we do a biopsy? They do a biopsy, and lo and behold, it's lung cancer.
Oh.
Well, why didn't they do a biopsy earlier? Because what 26-year-old gets lung cancer? That's the
Mhm.
defense, we don't have to do a biopsy. The test that we ran showed us to a level of satisfaction that we were satisfied that this was recurring pneumonia. And as it turned out, it was lung cancer that was growing. Ultimately, he died in his late 20s.
Horrible.
Very, very sad situation. A lot of our cases have to do with the failure to timely diagnose breast cancer. Of course, nowadays everyone hears about breast cancer screening. And it's not just breast cancer, it's also, for instance, for the men, prostate cancer.
Mm-hmm.
The screening tests nowadays um, have become very important. We hear about this every year when we visit our own healthcare professionals, or when it's advertised. Free mammogram studies. I think every town in Long Island has a free mammogram van that goes around during the summers, at least, giving out free and also prostate exams and PSA levels. Screening tests are very important. Of course, it's up to the patient to make the appointment and to have the test done, but very important for the test to be properly evaluated and analyzed to make sure, hey, is this a patient who we had the screening test and now needs another test, or is it all clear and we don't have to worry for another year? Oftentimes, those screening tests are misinterpreted. Not every time, obviously, but oftentimes they're misinterpreted, and that can lead to a potential lawsuit. So if you're having a problem, or if you're having a sign or a symptom, and that's irrespective of having a screening test, that's something else. But having a problem and taking the first step, making the appointment to go see your doctor, it's very important. I'll get back to the information. The importance of information cannot be overemphasized. Very important to keep on top of that. Proper communication going both ways, patient to doctor and doctor to patient, is the key. And if you have an elderly family member, very important to accompany the elderly family member, because sometimes they're not able to, don't have the information. A full list of their medications, a full history of their medical condition, a full medical history of all the medical conditions that they've had. Doctors need to see that. They need to analyze it and put it into the picture of what this patient is experiencing now, how it's affecting them, and what can be done in terms of making the diagnosis and a treatment plan. So that's also another important point to make.
It's great advice. Thank you so much. So how can people get in touch with you or any of the other attorneys at Pegalis and Erickson?
Well, we have a website, Pegalis and Erickson LLC. We're located in Lake Success, which is in Nassau County, but we have cases throughout New York State and also out of state. The Pigalis and Erickson website's pigalisanderickson.com. Very easy to find us. We have a lot of articles and a lot of information on our website about the various types of cases that we've handled in the past and are currently handling.
It's awesome. Thank you so much. I really appreciate your time today. You were terrific. I also want to thank Pigalis and Erickson for sponsoring this and for bringing this to light, because this is a very, very important, information that everyone should know about. And last but not least, I want to thank you, our listeners, for tuning in. If you want more information on this show or any other show, visit our website, HillaryTopperonair.com, or you can find us on Spotify, iTunes, or Google Play. I hope you have a great week, and we'll see you next week.